Developed by an experienced team of orthodontists, VectorTAS is one of the few temporary anchorage systems specifically designed for treatment of malocclusions.
Most of the screws on the market were just adaptations of other screw systems, either from an implant system, an orthognathic facial reconstructive system, small adaptations made just so that attachments could be placed. And that was just unacceptable because it was preventing me from feeling confident in my treatment ability.
VectorTAS is a complete system with a full array of orthodontic-specific mini-screws, attachments, and instruments that make the adoption of temporary anchorage easy and highly effective.
What I like about it most is it's a nice, simple system. It's something clean, neat, easy for the patients to care for, and in my view, at least, it's something that's fairly easy for the attending orthodontist to be able to use.
Each 10-patient kit includes 18 mini-screws, an assortment of springs and other attachments, a driver with tips, and more.
Up until this point, orthodontists would have to, go on a treasure hunt to try to piece together a mini screw with some sort of mechanics and training, and it was just so complicated. I think that's one of the main reasons that up until now, orthodontists have tended to shy away from the process.
VectorTAS mini screws deliver maximum strength and stability for reliable clinical performance. Mini screws are pre-sterilized and come in 4 sizes. Plus, VectorTAS mini screws are color-coded to match specific implant sites, which eliminates guesswork by matching the color of each VectorTAS mini screw with its ideal anatomical and biomechanical implant site. The proprietary VectorTAS Atlas takes into consideration bone type and density, intraradicular space, and tissue depth. The 6mm and 8mm mini screws have a smaller diameter and collar for placement between roots in thin cortical bone with attached gingiva. Meanwhile, the larger 10mm and 12mm screws are designed for placement in denser bone with thicker soft tissue. Constructed of titanium 6-4 for maximum strength, each mini screw is self-tapping and self-drilling, which minimizes the need for tissue punches or pilot drills. VectorTAS mini screws also include a number of other innovative design features: asymmetric buttress threads for enhanced pull-out strength, transmucosal collars that minimize the chance of infection, tissue suppression stops that prevent tissue overgrowth, and eyelets for indirect anchorage ligation. Each mini screw is equipped with a specific thread design based on soft tissue depth and density of bone. The thread forming design of the 6 and 8mm screws creates a more intimate purchase in thinner bone, while the thread cutting design of the 10 and 12mm screws is ideal for more dense bone.
The design of the threads, an asymmetric buttress design, is a thread form that's highly retentive and resistant to pull-out. It allows us to use a myriad of mechanics without worrying about the screws becoming unduly mobile and actually failing and having to place another screw.
Finally, the double delta head of each mini screw contributes to greater treatment flexibility and patient comfort, with no sharp edges from wire slots or hex bolts. This unique shape also eases loading and removal of auxiliaries while maximizing retention.
When the Vector team came up with the idea of this delta-shaped, triangular-shaped head that would allow us to create auxiliaries and springs and various devices that could be easily placed over the top of the screw head without the use of ligature wires through minute holes and without having to bond wires to the head of the screw, I think that was probably the most revolutionary change.
VectorTAS includes an assortment of TAD-specific auxiliaries to maximize vectors and force levels, providing you with more controlled movement and better force management. Coil springs are available in a variety of lengths and force levels. They feature a delta-shaped eyelet that locks onto the mini screw while allowing full freedom of movement. The swiveling head eliminates unwanted rotational and torsional forces associated with loading and unloading. There's virtually no need to ligate. Other auxiliaries like the crimpable post are clinically robust to withstand clinical forces and offer multiple force vectors. Plus, a flat profile ensures patient comfort. In collaboration with AOA Laboratory, the AOB splint is designed to treat anterior open bites. It quickly and easily intrudes the maxillary posterior segment and is equipped with multiple vector hooks to facilitate Class II or Class III correction. Needle-free injectors like the Sirajet provide a virtually pain-free means of delivering local anesthesia without the safety and disposal concerns typically associated with conventional syringes. The Sirajet features variable injection dosage up to 0.20 cc's and uses a standard 1.8 cc sealed ampule. Within seconds of administering anesthesia, the patient is ready for mini-screw placement. After the patient is properly anesthetized, VectorTAS drivers make mini-screw insertion easy for doctors. Simply open the lid of a pre-sterilized VectorTAS mini-screw container. While grasping the driver in one hand, press its head onto the top of the screw. Pull the screw straight back and out of the container. With the balled end of the driver firmly seated in your palm, press the screw tip firmly through the gingival tissue and seat it against the bone. Use your forefinger and thumb on the turning shank to advance the screw. With VectorTAS, you have a complete system to treat your patients faster, more effectively, and with less reliance on patient compliance. Move your cases in the right direction with VectorTAS.